As a medical interpreter, one of the very first things that I do when I walk into a room to interpret for a family is introduce myself. I always let them know my name and that I'm going to be their interpreter. This is very important because if you don't do this, the family might mistake you for a Spanish speaking provider. They might start asking you questions, or they might start thinking that you're the one who's there to explain things. Before we even go into the room, I always let the doctor know that I will be introducing myself first, because sometimes the doctors just walk right in and start talking, and I don't get a chance to do that. So now I've gotten into the habit of letting them know I'm going to introduce myself first, and then we can get started. So make sure that you always introduce yourself first so the family knows that you are their interpreter and that you are there to help them. Being a medical interpreter has just so many things that we do that you normally wouldn't think a medical interpreter does. I think when I was going to become a medical interpreter, I thought, okay, I'll just go into the room, I'm going to interpret, and everything's going to be perfect and smooth. I really thought that people were going to trust me as the medical interpreter in the room, but it doesn't always happen like that. Keep it in mind. You might get questioned, you might get interrupted, you might feel embarrassed in that moment, but be confident in knowing that when you've used a term and you know that it's right, you can trust yourself. And if you have to take a little extra time to explain it to the provider, then go ahead and do that so that next time when they hear somebody else using the term that you used, they won't interrupt that person as well. I've encountered situations where I've walked in on doctors trying to speak Spanish to the families when they're clearly not Spanish speakers. I've noticed that the families just nod and smile politely, and they don't really say anything. They don't interrupt or ask any questions. The doctor walks away, and the family probably didn't understand any of that. So what I've done is I've gone up to the family and I've let them know, um, you have medical interpreters available here to help you. So if a doctor ever comes to you with their little Espanol, please don't be afraid to say, I'm sorry, but can we get an interpreter because I'm Spanish speaking and I really want to understand everything that's being said. This is important medical information. You should have an interpreter. And so part of being an advocate is reminding and encouraging the families to request a medical interpreter when the doctor clearly doesn't speak Spanish. Here's a little tip for you, maybe something you've never thought of. When we listen to process information. We don't listen to retain in detail. We actually take listening for granted until we start to be intentional. For interpreting, you have to be intentional about listening, and therefore you must listen to retain, not just to process. How many times have people asked me, how do you say this? And then they just give me one word. And I'm like, well, what are you trying to say? Well, I just want to know how to say that word. No, I need context. Otherwise, I don't know what word to give you or how to say that.